to address my join button. If you do want to support me and take part of my YouTube channel, you can click join, and for $3.99, you can have exclusive video for your group number 1. And if you want to know what I do right now, for who I work, what kind of interviews I do, there would be a special section on the zone 799, where you could see the companies that I work for, my daily or weekly experience, more or less. And there would be a special place there dedicated on how your resume should look. And you can enjoy that for $7.99. I will also answer your questions directly. Said that, today I have a pleasure again to have Miss Natalia as my Russian interpreter to create another bilingual medical interpreter video. We're gonna create so-called bilingual target language proficiency test video. And that's terminology that you need to know for your medical interpreter test. Or as well, if you're gonna do CCHI, which is the national certification here in USA, or National Medical Interpreter, NMICMBI, sorry, forgive me guys for the abbreviation, the another test that you can do, that you can be accredited here in USA. For both of these tests and accreditations, you need to know the terminology. And I have the pleasure to have as a guest Natalia, which is going to be in our role of a Russian interpreter. Go ahead, my dear Natalia, introduce yourself.
Hi, guys. Добрый день. Доброе утро, где бы вы ни находились. Да, меня зовут Наталья. Я родом из России, но в настоящее время работаю в Лондоне. Я устный и письменный переводчик с английского, испанского и русского языков. Работаю во многих сферах, поэтому буду рада помочь вам в ваших устных письменных переводов, поэтому обращайтесь. И надеюсь, что это видео сегодня, которое мы запишем, тоже вам поможет в ваших экзаменах и ваших устремлениях. Спасибо.
Спасибо, дорогая. Thank you, Natalia. It's such a pleasure to have you here again. Thank you. So we're going to start right away because I know, guys, you don't like when I have a long intro, but sometimes I get a little bit distracted, but I will try to stay focused here with Natalia. And we're going to start with our first term, which is induced delivery or induced labor.
Стимулированные роды. Стимулированные роды.
Спасибо. Birth or a birth control. Birth control.
Противозачаточные средства. Контрацептивы. Противозачаточные средства. Контрацептивы.
Спасибо. Hiccup. Hiccup.
Икота. Икота.
Large intestine. Large intestine.
Толстая кишка. Толстая кишка.
Liver. Liver.
Печень. Печень.
Shortness of breath. Shortness of breath.
Одышка или затрудненное дыхание. Одышка или затрудненное дыхание.
Извини, I want to ask you a question.
Да.
Иногда я слышу, они говорят, не хватает воздуха. Это правильно или нету?
It is, yes, but it's
Ну,
more
это
like
жаргон.
colloquial. Yeah,
Okay. So, не хватает воздух is like more like a slang for
yeah,
us, like lower register. Is that correct for you? Lower
it's just
register.
it's then how the normal person would describe it, I guess.
Yes. So I want to go to the medical again. How would you prescribe it as an interpreter?
Одышка, I would say, or затрудненное дыхание.
Молодец. Okay, and so if it's a lower register, Deva said не хватает воздух, which means the same thing, but just you guys know I love this because you can give us both. Thank you, Natalia.
No problem.
Heartburn. Heartburn.
Изжога. Изжога.
I have another question here for you. You know, I'm learning so much from you. What is the difference between изжога и кислота? Потому что иногда I have somebody, oh, у меня есть изжога или у меня есть кислота. I somewhat related to the same problem with the acid reflux, but can you say for us, or this is again the lower and a higher register?
Well, I guess кислота as an acid is just the result of like the symptom of изжога, heartburn.
Oh.
It's kind of, you feel acid kind of rising up and you feel acid in your stomach is when you can say that you have heartburn. Basically.
Beautiful. Thank you.
No problem.
That makes a lot of sense because I see the lower register, they will use у меня есть кислота, и я принимаю, ну, там таблетки, что такое, but the correct one is изжога, which is the condition.
That's
Correct.
right.
Beautiful. Ward.
Палата. Палата.
I don't even know right now what this means in English. I forgot. Can you clarify for us in Russian? Just sometimes, you know, when some words speed your head and is like good to, just for everybody, I forget occasionally, but what was that?
It's a room where they keep a patient.
Ah.
Basically.
Because in my head, ward is like a wound.
Ah.
Sorry, forgive me.
No, don't worry.
So can you tell us the wound in Russian?
Рана.
Это рана. So because sometimes the spelling probably is very wrong on this piece of paper that you see, but sometimes the doctor says, you know, people that have diabetes have these wounds on the feet or somewhere, you know, and they ask, oh, do you have a warts or wounds, open wounds on the skin? And I always relate them together.
Okay.
And I was thinking that it's some specific kind of wound on the skin, you know?
To be honest, I don't know.
You never heard it?
Yeah, I thought it would be just, yeah,
I don't know too. Yeah, just рано. Спасибо. Wheezing. Wheezing.
Сипение или синдром легочной обструкции. It's more technical, I guess. So, сипение или синдром легочной обструкции.
Я хочу спросить вопрос, а какая разница между сипением и храпением? Потому что они очень часто используют храпение.
But well, храпение is like in snoring.
Correct.
When
and
you
wheezing is the
night.
small noise when you breathe, correct?
Yeah, well, because you can wheeze, I guess, when you're
with
just
not open
in the
mouth,
daytime.
but oh,
yeah.
It's when your lungs wheeze then, basically.
Yeah, you go about and you can't do anything about it because it's the it's the condition, right?
Yes.
You can't control it. While snoring, you're sleeping and you just
snore.
Yeah, you snore. Yeah.
Thank you. Yes, makes sense. Fever.
Лихорадка. Лихорадка.
Kidney failure. Kidney failure.
Почечная недостаточность. Почечная недостаточность.
Airway obstruction. Airway obstruction.
Обструкция дыхательных путей. Обструкция дыхательных путей.
Eye diversion.
Дивергенция глаз или в народе косоглазие. Дивергенция глаз или косоглазие.
Спасибо. Then we have sonogram. Sonogram.
Снимок УЗИ. Снимок УЗИ.
И еще я использую ультразвук. Они
Да.
просто... Это правильно или нет?
УЗИ — это аббревиатура, как раз стоит первые две буквы УЗИ, да, ультразвуковой. И, если
Imagine.
честно, не помню, да.
Изображение.
Ультразвуковой. По-русски что-то, наверное, будет по-другому. Надо будет, да, посмотреть, как она. Но вот У и Z, оно стоит как раз за ультразвуковая.
Хорошо, спасибо.
Мгм.
Тетанус.
Столбняк. Столбняк.
Седатив. Седатив.
Успокоительное. Успокоительное.
Это неправильно, если они используют это слово как наркоза или sedative просто успокоительно, потому что here in USA, when you say sedative, is more like when you use it for procedure. Normally American culture do it like this, but I know in Russian you have успокоительно. Do you have another word for
Наркоз?
наркоз тоже? Но это правильно или неправильно? Если он говорит, они меня they put me some sedatives and I fell to sleep, let's say like that. Is that
Yes.
gonna be успокоительно или is gonna be like narcos? Or depend? Is it correct to say?
I don't think so, to be honest, because sedative is, I would imagine, like a medicine that they give for you to sleep and for your nervous system to come down, right? While narcose is they give you before they do surgery, and it's like a very deep sleep and
sedation. Okay,
it's more like anesthetic.
Okay. So you have anesthetic in Russian too, as a word.
Anesthesia.
Anesthesia, да. Я знаю, but I was not sure if it was me that make mistake because of the Latin that I study. Okay, so we do have, so as Natalia said, we have sedative, which is успокоительный, and when you interpret for surgery, you could say narcos, да? If you have the test, you can say both words just to make sure you got the points.
Yeah.
Then the next one is vomit or vomiting.
Тошнить как глагол и тошнота, рвота как существительное.
Pain killer. Pain killer.
Более утоляющее. Более утоляющее.
I'm sorry, guys. I want to correct something because, forgive me, Natalia. I just wanted to, because this is part of the protocol that you should do. I just noticed. So vomit, as Natalia said, it is rvota, and tashnata is nausea. Just you guys have them both separately. She gave us synonyms, but in the test they're tied one to another, and they're gonna take points. And thank you, Natalia. So yes, vomit was rvota and tashnata was nausea, and I appreciate your professionalism. And we're gonna go with the next word that is cancer. Cancer.
Рак. Рак.
Pain. Pain.
Боль. Боль.
Can you say the word that when I am hurting, for example, my leg hurts me because I have problems with Fadezhev, you know? So ball is just pain, but when I say I have a severe pain in my abdomen, there would be another word, correct?
У меня сильно болит желудок. So you're it's a different way of saying it. You're using different structure.
Yes.
Basically, yeah.
Because sometimes when I said вам болит не что-то, is there like we don't understand you.
Okay.
So I was, you know, some people that come from this like, important city like St. Petersburg, and they're like aristocracy. They don't understand me. Brain tumor is the next one. Brain tumor.
Опухоль мозга. Опухоль мозга.
So this is like a different level of pain, and they use it in English. I know the first spelling is wrong. I just see the document. You probably was wondering what is that, but the first one is aging. Aging, I think, is this very strong constant pain. Then we have sharp, dull, and constant pain. Give us whatever you have in your head right now.
I'm not sure about the first one because I thought it was just aching, and it's kind of a synonym to pain when something aches.
Oh, okay. Do you have a word for
what
aching?
Болит.
Okay.
Боль. And as for the different levels of pain, I would say sharp is острая боль, dull, тупая боль, constant, постоянная боль.
Thank you. And then we have migraine. Migraine.
Мигрень. Мигрень.
А использую иногда головная боль или головоболие. Это неправильно.
It is right because migraine is a type of
Headache. I think
headache.
it's here,
Yes.
right?
But it's I think it's a more stronger one. It's like a very strong migraine.
Yeah, I think migraine is like when you suffer from this and you gotta take medicines.
And yeah, when you have nausea, you know, it's kind of
it's connect. So headache is just the normal people, and when we say migraine is the medical condition for your culture, is that correct?
I think migraine is more
severe, like you suffer.
Yeah.
Eye, nose, drops. Eye, nose, drops.
Капли для глаз и капли для носа. Капли для глаз, капли для носа.
Vaccine and virus, I put them together. Vaccine, we like vaccines here in America to fight the viruses.
That's right. Well, everyone now likes them, basically. Vaccine is вакцина, вакцина, and virus, virus, virus.
Thank you. Then we have gastrointestinal and gastroenterology. I think they're the same.
Желудочно-кишечный. Желудочно-кишечный.
Lung inflammation. Lung inflammation.
Воспаление легких. Воспаление легких.
Sneeze or sneezing.
Чихать. Чихание. Чихать. Чихание.
Sprained ankle. Sprained ankle.
Вывих голеностопного сустава. В народе говорят вывих лодыжки.
Да, я слышала это лодыжки, и я не смогла это найти. Это было так сложно. Я говорила, извините, что такое? Ну, я спросила, I asked the patient to explain, and I understand was something with the ankle. Лодыжки is like the lower register, right?
It's kind of more for lay person, and basically, as far as I understand, it's not exactly correct diagnosis. So the right one would be the вывих голеностопного сустава.
Okay, спасибо. Then move or moving.
Двигаться или движение. Двигаться или движение.
Joints.
Суставы. Суставы.
Dizzy or dizziness or feeling dizzy.
Чувствующий головокружение. Dizziness как существительное головокружение.
Okay, then we have a headache.
Головная боль. Головная боль.
Chest pain. Chest pain.
Боль в груди. Боль в груди.
Tooth.
Зуб. Зуб.
Syringe or syringe. I am not sure my pronunciation.
I heard like syringe.
It's syringe, the one that they put injections with.
Yeah. Шприц. Шприц.
Seizures. Seizure.
Приступы. Приступы.
Они иногда используют припадки. Это неправильно.
You can say it as well.
But this is the lower register, correct?
No, I think you can use them both basically in the same way.
Хорошо. Inflammation of the bladder. Inflammation of the bladder.
Воспаление мочевого пузыря. Воспаление мочевого пузыря.
Skin cancer. Skin cancer.
Рак кожи. Рак кожи.
Unhealed sore or wound. Unhealed sore or wounds, I give them together because the doctors ask them together.
Okay. Незажившая рана или незаживший нарыв. Можно еще использовать незажившая рана или незаживший нарыв.
Спасибо. Я никогда не слышала это слово. Это когда более серьезный нарыв?
No, actually it's less. It can be like, a little sore when it's not like an open wound, but it's like, it can be like a little sore and it's not even open yet, it's kind of
just reddish and disturbing.
Breeding there.
Окей. Спасибо, это прекрасно, что ты такая интеллигентная. Change of a mole. Change of a mole. And I remember that, I know maybe you would not find it. The doctor just asked if you have any change of a moles recently.
Okay.
And this is also challenging for me. So if you don't have the correct, you can give us like as you can, you're gonna still help us a lot.
I would say that because it's not like medical even in English, so I would again describe it in Russian as изменение в состоянии родинки.
Okay.
Изменение в состоянии родинки.
Спасибо. Nail deformation or decoloration. Nail deformation or decoloration.
Деформация или обесцвечивание ногтем. Деформация или обесцвечивание ногтем.
Muscle.
Мышца. Мышца.
Joint pain. We did the joint already somewhere, but can we do it together with the pain?
Sure. Боль в суставе. Боль в суставе.
A limb. Okay, there is these two words, and the reason that I put them together is because this is also challenging for the test. The joint and the limbs. What's the difference?
Joints are parts of the limb.
Okay.
Basically, like we have a like knee joints, we have elbow joints, right? Shoulder joints, anywhere that's kind of parts of the limbs are connected.
So how you gonna say the two words in Russian? I want to separate them so we remember them.
So joint is сустав,
Okay.
limb, конечность,
Ah.
конечность.
And they're plural normally. So we have, if we have limb numbness, what you gonna imagine? Because this is a tactic that I use when I interpret. Sometimes when I'm not sure, I use they call visualization and interpretation. So I will, what part you gonna imagine when I say limb numbness or limb pain? This is gonna be both, like end of the feet and the hands, or how?
Yeah, basically, well, it can be the whole leg even, or the whole hand, the whole arm rather. So in Russian it would be онемение конечностей или конечностей, if it's singular. Онемение конечностей.
Спасибо. Stiffness or being stiff.
Скованность или быть скованным. Скованность или быть скованным.
Then we have a bone pain. Bone pain.
Боль в костях. Боль в костях.
Back pain. A back pain.
Боль в спине. Боль в спине.
Artificial knee hip joint, just is there is, if there is a word for artificial, because they don't normally use it in Russian. I have some patients, I call them patients, but some people that they say, а мне там бедро поставляли, операция была здесь, because normally they use a тазобедренная кость, они сменяли, так они, they never use artificial. Can you clarify this for us and give us like the correct?
I mean, if you can still say искусственная, so the literal translation would be искусственная, искусственное колено, искусственный сустав, but I think people would understand it as протез, so it's kind of prosthesis.
Yeah, I think prosthesis is
what it
perfect.
Means. Yeah, протез.
Да, спасибо. And this is why, guys, I want you to listen what Natalia says, because you see, sometimes you can do the literal, but if you follow best practice, best protocol and core of ethics of USA, you gotta transfer the meaning. So if you go literally, you're gonna say искусственная колено, but if you gotta say correctly in order to make sure they understand you, you gotta use the word протез, which is gonna be focus on the meaning, because the practice has meaning for meaning. Then the next word is difficulty to walk. Difficulty to walk.
Трудность при ходьбе. Трудность или трудности при ходьбе.
Okay, then we have you fallen?
Вы падали? As far as I understand, this is like a question, right?
Да.
Yeah. То есть вы падали?
Or for example, the doctor say, have you fallen the last few weeks?
Падали ли вы в последние несколько недель?
Then, спасибо. Osteoporosis. Osteoporosis. And you can give them 3 of this. We have arthritis or arthrosis. They are similar, so go with it.
Osteoporosis. Then for arthritis, arthrite. And arthrosis is arthros. So it's very convenient because it's very similar.
Yeah, I love those.
Yeah.
It's easy to remember.
Yeah, basically. Yeah.
Neurological symptoms, whatever you like here.
Неврологический симптом.
Vertigo.
Головокружение.
Thyroid or thyroid gland, whatever you prefer.
Мгм. Щитовидная железа.
And I heard they use щитовидки. Is that
Щитовидка.
is
Мгм.
that like the slang or the
Yeah,
simplified?
it's kind of
Okay.
simplified but slang. Yeah.
Okay, if you do emergency, guys, you can use щитовидка.
Yeah,
Just so you know.
it's easier. Yeah, I mean, but they will understand. Мгм.
Then we have ulcer or ulcer.
Язва. Например, желудком.
Спасибо. Temporary paralysis of a leg or an arm.
Временный паралич ноги или руки.
Can you повторить, пожалуйста?
Временный паралич ноги или руки.
Speech difficulties or difficulties to talk. Whatever sounds more good for you.
Затруднения речи.
Спасибо. Then we have lymphatic. Sometimes normally go with a node. So if you want to give it with a node, it's just fine.
Лимфатический узел.
Anemia or low platelet count is the same thing just described. So whatever you pick, you can give us anemia or low platelet count.
Анемия или низкий уровень тромбоцитов. Анемия или низкий уровень тромбоцитов.
Easy bruising or easily bruising.
Yeah, this is more difficult one because you have to kind of describe it as this is not medical term, so it kind of describes just a person that easily gets easily bruised, meaning легко появляются кровоподтеки или синяки. Легко появляются кровоподтеки или синяки.
Я всегда слышала синяки от людей, знаешь. Кровоподтеки они не используют. Ну да, это правильно. И if sometimes если у меня проблема с синяками, it's the same thing, but simple, correct?
Yeah.
Then we have leukemia. Leukemia.
Лейкемия.
And lymphoma. Lymphoma.
Lymphoma. It's an easy one as well. Lymphoma.
Okay, and that was our conditions with Natalia. Today we did Russian. I appreciate your knowledge, Natalia. I appreciate clarifying lower and high register for us and for whoever is watching, guys. As you see, I study English and Russian for over 20 years. And I always like, there is never too late to learn a new things. There is never such a level that you're such a master in a language. I learn every day from the patients that come from Azerbaijan, Kazakhstan, and Ukraine, and any other country that speaks some type of Russian. And as you could see, there is many difficult and different expressions based on your cultural level, that you can have the simple ways like lower register and the higher register that Natalia gave us. Thank you guys for being here. I hope you enjoyed this video. Thank you for liking, sharing, and subscribing. Thank you for your support. I would also like to let you know that I will leave the information of Natalia below this video. You can find her email and her LinkedIn if you do need Spanish, English, Russian interpreter. She's located in UK, and if you need somebody for your business, you can buy her a ticket to interpret for you and fly to your business trade fair. Also, you can do the same for me. Don't be shy. I'm located in USA, but I can travel anywhere possibly. And it was a pleasure to have this video with you, Natalia. Would you like to tell us something? Closing statement?
Yeah, it was a pleasure, really. And again, I hope that this will help you guys with your tests, exam, whatever you're pursuing. And yeah, feel free to contact us for any of your interpreting or translation needs. And I
Thank you
see
for
you.
being here, guys.
Thank you.
Bye-bye.
Bye.